Good morning, everybody.
Good morning, gentlemen.
It's good to see us again.
I've been really blessed among these three amazing gentlemen.
Oh, you should take us for,
You're gonna be like that.
You've been
blessed
since Monday.
Like Olamide will say, it's real money, so it's not a problem.
You've been blessed since Monday.
Oh, I know, right? But anyway, you're very
Maria,
good
I
morning.
love the red. It's beautiful.
Oh, thank
it looks
you.
good on
Thank
you.
you so much.
Maybe I should take you out now.
She's the lady in red.
Nelson,
Right.
it's finally Thursday, so Ibrahim, you're good, right?
Absolutely.
Today's Thursday.
Absolutely. I can't wait for Friday.
I know, right?
On the weekend.
But anyway, a very good morning to you, Nigeria. Thanks for joining us. You know how we do it. Let me give you a rundown of what we'll be doing on the show this morning. At some point, Ibrahim will bring us all the headlines that have made it to the newspaper. We get to talk about it and dissect it right here on this table. We're going to take you to the police headquarters where we speak about the new IGP of police. Now, the president has decorated him. But after all the congratulations, what next? The work has to begin. A guest will join us where we'll talk about some of the things that we expect from the new IGP. When we take you all the way to Abuja, we'll be talking about the City Boy movement. We'll talk about the ideologies that they have. Abuja is going to give us more updates on that particular one. So these and many more on the show this morning. Do make sure you join us, grab your cup of coffee, and let's have a very fantastic one. Now we'll start with the story. A bold intervention in grassroots healthcare is unfolding as President Bola Tinubu says over 98 billion has been injected into primary healthcare within 1 year. The president said the funds were disbursed through the Basic Healthcare Provision Fund to support more than 8,300 primary healthcare centers. The investment has led to the upgrade of over 2,500 centers, many more under works. The president added that funding will be extended to 13,500 facilities alongside expanded health insurance and large-scale training of health workers nationwide. With this level of spending and reform, will Nigeria finally feel real change in healthcare at the grassroots? So this is the conversation we'll be having this morning, Mr. Biodo. It's a good one to hear that, in a year, look at what they have done to primary healthcare. We understand the importance of primary healthcare. It's the backbone. I feel like if your primary healthcare is fantastic, then the burden will not be so much, on other healthcare systems. Oftentimes we've complained that, in the rural areas, there are no hospitals, there are no nurses. Like, even if there are hospitals, they are not, they're not in right positions, for people to go. But now we're hearing that this amount has been pushed, into our primary health care. What do you make of it?
I think this is brilliant. If you look at the president, he made it very clear when he came into office, he will look into national challenges in the areas of economy, security, health, education. On education, he's been able, to introduce the students' loan and, create an enabling environment for students to study, devoid of the prolonged strikes that we used to have in the past. In the area of economy, we've seen even the IMF asking other countries to go and study how Nigeria has actually implemented reforms. That is, we have become a case study. In the areas of security, we've seen the whole security architecture being overhauled, and the president, making it very clear that it will be tough on terrorism and causes of terrorism. Now on healthcare, a huge amount of money has been injected into it. Remarkably, not since Professor Olikoye Ransom Kuti was the health minister in Nigeria that he actually promoted or established the primary health care in a way that we've never had before. No one has been able to revamp that sector until now. This is good news. This is good for the people. We're looking at areas of direct care. Not every single treatment can be provided within confined hospital, major hospital buildings. A lot can be done through primary health care, and this is good news, particularly for the poor people.
Very good news. And another thing, Nelson, that the president added that funding will be extended to over 13,500 facilities, and also there's going to be a lot of training of health workers, because oftentimes we've spoken about the health workers not even understanding their job properly. And we love to see that there's going to be an extended version to a lot of facilities. But as we celebrate this, like we say when we mention all of this, we just pray that right about now the money goes into the right places and the implementation is done, that it can stand the test of time.
I absolutely agree with you, Ria. But this fund is not as though it is the presidency that is directly managing primary health care centers across the country. No, it is passed through state governments. And so Nigerians must know that if a PHC is not working at your level, then you should hold your governor to account. Because the presidency is coming out now to tell us that, look at the amount of money we've injected to you guys, so you need to know where to point your fingers to. And this is really important. I just came back from Kogi State, and one of the things Governor Dodo was, kept saying over and over again to me was that a lot of these projects have been made possible because of the impact of President Bola Tinubu talking about increased funding to state governors. And this is really critical because, we're very fast to point our accusing fingers to the presidency and then, the center, negating the next one close to us, which is our state government. And so this is really important. If the government is doing this, Ria, if you travel around the country, you get to see the importance of a working primary health care. Because sometimes it is distance to tertiary healthcare in states. And so if a primary healthcare is not working at ward levels, at council levels, then it becomes a wahala. So kudos to the Tinubu-led administration for doing this. We want to see them actually working.
Exactly. And Ibrahim, I'll come to you with accountability. Just as Nelson has said, we need to start holding people accountable because we know that this large amount of money has been ingested into primary healthcare. Like I said earlier on, primary healthcare is like the backbone. When you go to the grassroots, some of these people really suffer. And most people that really go through a lot is the pregnant women that want to give birth. They really go through a lot in the grassroots. But we're hearing that this money has been put in. Now, how are we looking at implementation? How are we looking at also, just making sure that the money doesn't pass somewhere else.
That's right.
It goes to the right place.
Right. So Nigeria is very big on policies. We make policy reforms and all of that, but implementation is usually the challenge. So that's where the question is. But if you ask me, 98 billion naira, that's a huge amount of money. Some will say it's huge, but the reality is that it's to take care of over 8,000 primary health centers. But we have over 30,000 primary health centers across the nation. So meaning that it's still like a drop in the ocean. So we'll be looking at, taking care of the infrastructure, taking care of, the staff welfare, because it's very key. If you go to some of the local, local government areas, some places that are maybe not really deserted, but you see that it is only one staff in some primary healthcare centers, and then the infrastructure is not really there. So if we take care of the health system in the Nigerian nation, of course, there will be much more productivity. And one thing is we should also look at the staff welfare and things, because the brain drain is there. So people are still wanting, the doctors are still wanting out and all of that. So normally it should be the first line of treatment. Maternal, death will be taken care of, malaria and all of that thing. It should not be that people will have to go to tertiary health care centers and all of that. Those ones should not be the, the fire brigade approach. They should, these are some of the things. So
handle
if they are
secondary matters.
Exactly. So if they handle health problem at the primary level, then there will be no need to go IHOP there. That's where there will be
it's
crisis.
even beyond that. I think it's about direct care to people, even in their own community, in their own home, particularly people in rural areas. If you don't develop your primary health care, you have a problem. How do you expect somebody to leave a village in Oyo State to head to UCH? It's almost impossible.
That's why they say that.
This is good news for rural dwellers. It's not just the responsibility of federal government. We need to understand that the states and the local governments are also involved. So they also need to come up with some money to augment whatever the federal government is doing so that we can get the desired result.
Exactly. That's why they said that if primary health care, works, the entire health system works. But if it collapses, then everything becomes management crisis. I mean,
exactly. Just like what we've all said on the table, we just hope that it's implemented, and not just implemented, we hope that it stands the test of time, because it's a fantastic initiative. And, like the presidency or not, we also have to acknowledge them for these bold moves that they are making. Yes, we'll go on a quick breather now. When we come back, it will be time to dissect all the headlines that have made it to the newspaper. Don't go anywhere. Stay with us. This is TVC Breakfast.